Hey everybody, welcome back. Dr. Frost. We're going to continue in our head to toe aches series with the video on knee pain. So we're going to give you a couple things that you can do to look at the symptoms, decide if those symptoms fit what your problems are. We're going to give you a couple diagnostic challenges that you can do at home to see how severe your knee pain may be. And then we're going to give you 3 exercises that you can do at home to treat yourself. So if you're ready, let's get going. Knee pain. There's almost always 4 things involved with knee pain. And it doesn't have to be 1, 2, 3, 4, but it's almost always some combination of these. And number 1 is, does your knee pop? Does your knee lock? Does your knee hurt going up or down stairs? And do you ever have a sense that your knee is going to give way, or does it actually give way on you? If you have a yes to 1 to 4 of those, probably you've got knee pain. Now, functionally, if you want to say, okay, I have some of those symptoms, how do I really know? I want you to do 2 things. These are called functional tests, and the first is called a squat test. So what I want you to do is just squat. Do you see how I'm squatting? And do you see how my knees are symmetric? And do you see how they're even from side to side? Now watch me get up. I'm going to rise from that position. If you have knee pain, this is what you'll find. You'll squat, but one knee will go down, the other will stay up because it's full of fluid and it hurts, and you won't be able to rise without putting your hands on your thighs and helping yourself up. Very easy, but really indicative of an active knee pain process. The second one is called the hop test. Now be careful with this one. I want you to make sure that you protect yourself and that you have something to hold on to in case the knee gives way. So hold on to a wall, hold on to a table, but make sure you're secure. And then what I want you to do is stand on the knee that hurts and hop. And let the weight of your upper body come down on that while you're supporting yourself in case it gives way, and hop. If you have pain doing that, again, really good indicator that you've got an active knee process going. So let's say part 1, you've got some of the symptoms. Part 2, yes, I can't squat or it hurts to hop. Number 3, what can I do right here, right now? Without a doubt, let's use the ICE principle and ice it for 10 minutes, but also do these 3 exercises. So, lay on your bed, no couches please. You may have to take your shoes off if you can't slide your feet normally, or easily I should say. But the first thing I want you to do is sit up from the sliding position so that your knees are flat. And we're going to do something called a quad set. Now be very focused on this leg. We're going to pretend that I have right knee pain. So I'm going to contract this right quadricep muscle, this right thigh muscle. Can you see my knee pushing down on the table? If you can, that's what we're trying to do. We're trying to pump that knee a little bit, give it some motion, and hopefully relieve some of that fluid and some of that pain in there. That's called a quad set. The second one, I want you to now take the good knee, the good one, and I want you to pull the heel as far as you can towards your butt. And when you do that and you get it as far as it'll go naturally, take a pen or a piece of tape to mark how close you got to your butt. Then let it out, take the other one and slide it back. Remember I told you if your shoes keep you from sliding, take those off, just use your socks or your bare feet. And see if you can come to the same level, right? Because your knees should be able to do the same thing on both sides. If they don't, then you know that you've got something going on in that knee. So this exercise is called a heel slide, and you simply pump the knee 3 to 5 times and just keep sliding it, just like that. And the third one is called a combination of heel slide and a leg lift. Do you see how this creates some passive drainage? So you drop the knee or the foot back to the surface, go out, heel, slide it back as far as it'll go, lift, and then drop it again. 3 to 5 times, so easy. There's 3 things that you can do to treat your knee. If it keeps bothering you, that doesn't relieve it, we're here for you. Come on in and see us. See you again. Bye-bye.